Tēnā koutou, tēnā koutou, tēnā tātou katoa, nā mihi whakanui kia koutou. Ko Sierra Nevada, nā monga, ko Yuba Te Awa, ko Julie Anne Genter, aho. It's really wonderful to be here with all of you this morning. I'd like to start by thanking Dr. Ashley Bloomfield, who's the Director General of Health and is my go-to person every time I need to try and make something happen in my portfolios. And of course, he's leading a really excellent team at the ministry who are working as hard as they can to help the government implement a slightly different and more holistic approach to health and well-being. Thank you so much as well for the welcome, Charlene. Firstly, I just want to thank all of you for the work that you're doing in whatever area you are working in health. I know that to get the sorts of outcomes that the government aspires to, like eliminating child poverty in New Zealand and ensuring better equity of access to health services and healthy outcomes, especially for Māori and Pacifica people, to make Aotearoa New Zealand truly the country that we aspire for it to be, one where everyone has the opportunity to live a good life. The government can't do it alone. We need thousands and thousands of New Zealanders out there every day doing their bit, whether it's through their professional work or through their volunteer work, through their families and their communities. So thank you for what you do. I thought I would just bombard you with some slides since I have the opportunity quickly this morning, but I'll put on my timer so I don't go over time. So before I became a politician, I worked in transport and urban design, and the reason I'm so passionate about it is because it's one of those areas where we truly can get win-wins, where we can get much better health outcomes, where we can get better mental health outcomes, where we can address the harmful pollution in our towns and cities that affects our air quality but also affects climate change, and where we can have the opportunity to have more connected and happy communities. So healthier, happier towns and cities is the way in which I want to link up my associate health portfolio and associate transport portfolio. And I think it's helpful. Some of you will be already aware of all of this and working in this area, but sometimes we think in the health system it's all about responding to illness. And that's what our hospitals and our GPs and our specialists and our nurses, what they all help with. But we want to get out in front of illness, and we want to promote wellness. We want people not to get those non-communicable diseases in the first place. And to do that, we need the health system, but we actually need to use a lot of the levers out there in our physical environment and in our services that we're delivering through housing, through education, making sure people have sustainable incomes. But I would recommend for anyone who's interested in this topic, there's a lot of excellent research in this book, Happy City, which talks about absolute wealth of research, although it was published in 2013, so there'll be even more since then. It's a fantastic read about how urban design can help support well-being. And so, up here on the slide, I say healthier, happier towns and cities are absolutely necessary to deliver the government's objectives in terms of improving well-being of our people. And a big part of this that is often overlooked is walkable neighborhoods. That's a place where people can easily get to the store, get to work, get around town, kids can get to school under their own steam. And that's something that we used to have in New Zealand and that we can have again. But the reality is that it's been declining. People's use of walking and cycling and public transport declined significantly from the late 1950s, early 1960s, right up until the early 2000s. And it's only really turned around in our big metro centers. Wellington kept it pretty well, but Auckland's made a big turnaround in the last 15 years due to choices made by central and local government about what to invest in. So when we create walkable cities like this, walkable neighborhoods, it gives people a greater choice about where they live, and it reduces the amount that they have to spend, the amount of time they have to spend in a car. And that has directly related to some of the health outcomes we want to achieve. But studies show those neighborhoods are associated with increased physical activity, lower levels of obesity, hypertension, and diabetes. And actually it goes further than that. We know that higher levels of physical activity are associated with reduced rates of breast and colon cancer, better mental health, again, the lower obesity rates, lower heart disease, stroke, and the list goes on. But many people aren't getting their minimum sort of required or recommended physical activity. And although we try to promote physical activity through sport and gyms and other things, the reality is it's not working. But when we create physical environments where it's inviting for people to walk, where it's safe for them to use a bicycle, it won't work for everyone, but there are large numbers of children and adults for whom walking and cycling is a realistic option if we prioritize the infrastructure and if we make it the easy and convenient thing to do. And this is true in New Zealand. So this is from the New Zealand Medical Journal. There was a research from the University of Otago. New Zealanders who walk or cycle to their main activity each day have a 76% higher chance of achieving those physical activity guidelines compared to those who are reliant on cars to get where they need to go. And this association works for people who are in work or not in work. It holds for both those groups. So that's here in New Zealand. Now, why aren't people walking and cycling? I don't think it's rocket science. This is an aerial photo of a part of Auckland, which, botany. What do you notice about this? Most of the land is used, there are some trees, which is a good thing. We know that trees in nature are important for mental and physical health as well. But the rest of the environment is either for moving or storing cars. A lot of it's empty, and it creates a really unpleasant environment for people. So in this area, people are likely not even to walk from one shop to another because the environment tells you drive. And actually, it makes it very unsafe and difficult for people to walk and cycle. And so it's not surprising. We can't really encourage people to get on their bikes, especially children, when this is what their urban environment looks like. But it is possible to change that urban environment. We ended up with this environment not because it had to be this way, but because traffic engineers and urban planners in the 60s and 70s thought the biggest problem we had was not enough parking and not enough lanes to move cars. And that's totally understandable why you would define the problem that way, but the solutions they came up with ended up reducing people's choices and ended up making it harder to get around towns and cities without a car. And so now it's totally understandable, and I would never blame people for using a car. It's not on them. It's on us, politicians and planners and traffic engineers, to create an environment that gives people real choices and that facilitates that everyday activity that we know will benefit our communities. And what are we here for if not to deliver communities that just support people's health and happiness? So we have all the research, we know how to do it. We know that these sorts of solutions don't eliminate congestion, but they do cut off communities and make it really hard for people to get around in other ways. What could we And then here, look at this poor schoolgirl trying to get around in an environment where she's the only person on a bike, and the environment is perceived to be dangerous. In fact, it probably is dangerous for her. And we know that there aren't equitable outcomes because in communities like South Auckland, Māori and Pacifica children are not only more likely to suffer from inactivity, which leads to obesity, which leads to other health challenges, they're also more likely to be hit and killed by a car. And that's because of this physical environment. But we can do it differently. And if we look overseas, we can see countries who've chosen to prioritize the infrastructure that makes it safe and comfortable for walking and cycling. And in those places, more people walk and cycle. And you can see the same thing in New Zealand, in the places where we create these wide, separated cycleways, where we have slower speeds, more people choose to walk and cycle. And this is because people respond to the physical environment, but it's also people copy each other. So when it looks normal, when lots of people are cycling, then more people do it. And so in an environment we're in now, where it's pretty abnormal because the normal thing to do is drive, it's really hard to break that cycle to get people walking and cycling. But the key way to do it is through infrastructure change. And I want to show you how that can happen. just to kind of inspire you about the possibility. So this is a typical sort of place that's put aside a lot of space for moving and storing cars and hasn't given much attention to people. And if we changed our planning rules and allowed more flexibility, took a different approach to managing parking, really prioritized that pedestrian and cycling infrastructure that is really much cheaper to provide than providing for each person traveling alone in a car, and we allowed more housing to be delivered over shops and a more diversity of housing. You'd still have standalone houses, but let's offer some more housing within the urban area. And then over time, you build up that population of people and you turn an area that was totally unwalkable into one that is balanced, walkable, has the public transport priority. And of course, there's still cars in this picture, but it's not 8 out of 10 trips by car. It's more like 4 out of 10 or 5 out of 10, and there are huge benefits to this. And here's a couple other examples of how things could be different. And I do want to emphasize that overcrowding is also not good for mental and physical health, but we can strike a balance. And all of the research around health and happiness shows that people are actually happier when they have those face-to-face engagements with people on the street, on the bus, on the train, in the shops. And when they, again, get that physical activity, there's not just physical health benefits, but there are mental health and resilience benefits to that as well. Not to mention that although this might look more expensive, it's actually less expensive than what we're currently doing, where we rely on very expensive infrastructure, everyone having to own their own car and run it, which is very costly. So this is the sort of change that I would like to see in New Zealand, and I believe the research is there that people want these sort of options, and ultimately it's not they who have chosen, car-dependent suburbs and having to commute by car. Some people will like that. Car is a perfect option for somebody who has an injury or a disability, when you're moving house, for tradies who are carrying around lots of heavy equipment, and that will still be an option for them. But we have to put people first in our transport planning and urban design if we really want to support the sorts of communities that will help people's physical and mental health and promote that well-being. And of course, we have to be thinking about equity as we're delivering this, ensuring the community is involved in the designs, ensuring that it's delivering not just for the wealthiest New Zealanders, but actually for those who right now face the greatest financial and social barriers, because that's the kind of New Zealand we want. So, moving on, your next concurrent sessions, you'll be hearing about 3 initiatives that have or will contribute to improving the well-being of children, whānau, and groups right across Aotearoa New Zealand. The Cause Collective, a Pacifica social change agency that assists communities facing social problems and work with them and others to ensure that they have what they need to thrive. And this is currently through Healthy Families. Secondly, Te Ara Tika, an initiative showing how listening to the voices of young wahine Māori will improve the way our providers enable support to stop smoking and to design and deliver services. And finally, how the Mana Ake program will support the mental health of children in primary and intermediate schools in Canterbury and Kaikoura. So I encourage you to listen carefully to the stories being told in this session, the lessons being learned, and to use this to reflect on your own work, your situations, how you can adapt and innovate your services and strategies to better reach the well-being aspirations of your communities and their whānau. And of course, if you can share the message that I've delivered this morning about the importance of changing, the importance and the opportunity of changing the built environment in a way that will enrich the lives of all New Zealanders. Nō reira, tēnā koutou, tēnā koutou, tēnā tātou katoa.